is multi-casualty triaging? How do you triage victims following a mass disaster? So, mass casualty is actually defined as an event which generates more patients at one time than locally available resources can manage using the routine procedures. It requires exceptional emergency arrangements and additional and extraordinary assistance. Coming to triage, triage is it's a process of determining the priority of patient's treatment based on the severity of their condition. This rations the patient treatment efficiently when the resources are insufficient for all to be treated immediately. So it is actually a French word, triage, which means to sort. Earliest usage of triage can be seen in the Napoleon army, dating back to 1750s. The disaster triage system requires a rapid identification of critical injury without detailed investigation in a complex mass accident environment, and it can be classified into four categories: immediate, delayed, minor, or dead. Immediate, uh, this is life-threatening injuries that demand immediate attention to save his or her life, and they are tagged with the red tag or a symbol of the eye. In delayed, here the injuries does not jeopardize the victim's life and it may require the professional care, but the treatment can be delayed. This comes with a yellow tag. Then coming to minor, which is walking around, these patients walk around wounded and these patients are actually ambulatory and they come under a green tag. Coming to dead, here these patients will have no respirations even after two attempts to open the airway or dead or little chances of survival despite the medical or intense interventions. They come under a black tag. The triage can be of three types: primary, secondary, or tertiary triage. We'll see subsequently. The main principle of triage is do the most goods for most patients using the available resources. As the primary triage usually starts at the scene of the incident, prompt assessment and rapid transfer to the treatment center. This includes here the triage systems are of many types like STAR triage system, C, STM, military, burn triage, salt triage, etc. We will come to we'll discuss the STAR triage system. Which is simple triage and a rapid treatment technique. It was started in 1980s by the fire department, where they assess the walking, breathing, pulse, and consciousness of the injured patient. The STAR triage system is done in the field by the rescue person, and they assess quickly the respirations, perfusion, and the mental status. It comes as a sequence like if the patient is able to walk or not. If he is able to walk, they come under green tag and they can wait. If the patient is not able to walk, assess if the patient is breathing or not. If the patient is not breathing, try opening the airway. If no, if still apneic, consider as a death. And if after opening breathing there are attempts, they come under immediate care. If the patient is breathing, we can look for the respirations. If the respiration is more than 30 breaths per minute and they are tachypneic, they come under immediate care. If the respiration attempts are normal and less than 30 breaths per minute, we need to check for a radial pulse. If the radial pulse and perfusion is present, we need to go for a mental status examination. Like, does he follow or obey commands? If yes, we can delay the care. If radial pulse is not present or if they are not following the mental status, we can go for an immediate care. There is also a term called MSTAT, which is a modified system of the STAR, where the radial pulse assessment is used instead of a capillary refill because it is difficult in assessing the capillary refill in dark and the cold environments, and it is always difficult to interpret. Coming to SALT triage system, which is SORT, assess, life-saving intervention, and T for the treatment or transport triage system. It has 5 categories: dead, expectant, immediate, delayed, and minimal. Here there are 3 steps like sorting. Coming to sorting, we need to assess, is the patient still or obvious light to threat? We assess this first. Or the patient is waving and giving some purposeful movements, we can assess second. If the patient is completely walking, we can assess third and later. And coming to assess, we need to do an individual assessment like life-saving interventions, control the major hemorrhage, opening up the airway, chest decompressions, and antidotes if in case of any poisoning. And look for breathing attempts. If no breathing and still apneic, you can consider as a dead. If still breathing is there, we can go for other measures like obeying commands or not. How is the peripheral pulse? How is the respiratory distress? Is the hemorrhage controlled or not? And accordingly, we can group them either as a delayed or immediate. If everything is negative, we can group them under expected. Expectant is someone like they have only a little chances of survival. They come with a great tag. Step 3 in SALT is treatment on transport. We need to reassess and consider the patient conditions and safety resources every now and then. And in primary triage itself, we also have a reverse triage. Here, the injured people with fewer or minor injuries are at the priority of receiving the services, like in war, with the aim of returning the people as quickly as possible and helping the other people. We also have CBRN, which is chemical, biological, radiological, and nuclear exposure, the type of incidents where we can have a special measures, protective kits, and decontamination measures, and go for a triaging. And we also have a burn triage with the code of green, yellow, and red. Uh, with with the green tag, the patient will be under first degree and superficial burns. Yellow tag has burns with more than 30% total body surface area in the age group of 5 to 60 years old. With the red tag, we have people with second degree burns in head and neck region, genitals, and joints, and third degree burns in any anatomical region, or burns in patients of less than 5 years or more than 60 years of age, and in pregnant women. And coming to the secondary triad system, secondary triads, a secondary triad system in the field, like in cases where the transport of patients from the scene is significantly prolonged, secondary triad is done in the field. We have two systems for that, save and sort systems, which can be used for secondary evaluation of the patient. Uh, Save triage. Here the this is done when casualties are more than the transportation capacity or the hospital infrastructure. This is helpful to identify patients who are most likely to benefit from the care available under the field conditions. We need to areas of assessment comes like vitals, airway, chest, abdomen and pelvis, spine and extremities, skin, neurological status like we need to assess AVPU, alert, or responding to verbal stimuli, verbal commands, responding to painful stimuli, or unresponsive, which is AVPU, and the mental status. Uh, in SAVE, we assess three things. One thing is GCS, then comes the burns, then comes the MES score. MES is mangled extremity severity score based on the type of injury, shock group, ischemia group, and the age criteria. Uh, if the GCS is more than or equal to 8, we need to treat them immediately. If it is less than or equal to 7, we can go for a comfort care only. In MES score, if it is less than 7, the limb is salvageable. If the MES score is more than or equal to 7, we can go for amputation of the limb. And the burns. Then comes the burn score. Then we have sort system in the secondary triaging in the field. Like three steps. Step 1 is GCS determination. Step 2 is respiratory rate and the systolic BP categorization. Accordingly, we will be coding the patient in step 3, depending on the score obtained. With less than 10 score, they come under red tag. With 11 score, they come under yellow tag. And score of 12 comes under green tag, in which the patient can wait. In the tertiary disaster triage in the field, uh, this is like mostly communication based. Answers are sought to questions of which hospital patient will go, whether they'll go by land or air, whether we need to give a light, type of light and siren in the ambulance and everything. Local emergency communication or emergency operation centers should be in contact with the hospital in the affected area, the casualties and the bed availability, number of people injured and everything. This triaging gives the triage tags the triage area, cards and errors and everything. We also have the triage system for the pediatrics, which we call as a jumpstart triage, and PTT, which is pediatric triage tape. In jumpstart triage, it is similar to a start triaging, but this includes the uh, patients with age of 1 to 8 years old. It specifically takes into account that majority of the pediatric arrests are mostly respiratory related, and it codes accordingly. And in pediatric triage, we also assess the alert, moving the limbs or breathing, respiratory rate, and capillary people. Then we also have a triage, disaster triage in the hospital. Disaster triage in the hospital, uh, like ESI, Emergency Severity Index, which is a five triage system triage, and the cramps triage, which is circulation, respiration, abdomen, thorax, motor response, and the speech. Accordingly, they are scored and treated. Uh, that's also.
Yeah, it was again a very elaborate answer. Can be again shortened or formed a little bit more. Uh, so the word triage, as you rightly said, is too short. So this applies, triage applies when you have a lot of patients or lot of casualty injured patients coming to the hospital, or when you go to the field to retrieve them and transport them to the hospital, you must have a knowledge as to who are all the patients who can be salvaged by giving priority to them. For example, in a massive building collapse, the 500 people are entrapped in the debris, and you go and try to retrieve them. And some of them may be in the last stage gasping with no chance of retrieval because they have suffered such a major internal bleeding or a direct injury to the heart. And there is no point in spending time or wasting your resources on them. So it is mainly to save as many people as possible, at the same time not wasting time on people who cannot be saved. So that is the idea of this triaging system, which was introduced originally during the war time, because a soldier is an important person to continue with the war. So anybody who is wounded very critically and who cannot be saved, there is no point in wasting your resources, like you may be carrying blood to transfuse for emergency, and there is no point in spending all that blood on a dying patient. So from there only this system of triaging started, where you can save a useful person or a living person who has a chance to live rather than wasting the resources on a person who is almost on the verge of death. So that was how the whole system came, and the color coding and other things are given. So just to give you an idea about how to deal with this question,